you. Next up is a session to better understand the breadth of behavioral health field. We will have Dedra Chavis with North Range Behavioral Health, and Jennifer Zimmerman of Colorado State University will be presenting. So just a reminder to please stay muted, and please, 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 like you did this last session, use that chat for questions. Ask away. So take it away. Thank you.
Well, I'll go ahead and start out, Dedra, if you're all right with that. I'll give a little bit of an explanation. I'm Jennifer Zimmerman, and I work with CSU. My background is a little bit varied. I actually started working in higher education and have 24 years of higher education experience with a wide gamut of scheduling classes, advising, running a foster parent training for the state of Colorado. And I have to say, it was actually working with the foster parent training program and all the people around the state that got me involved in behavioral health and an interest in that. And then I worked in behavioral health for 10 years. My background is a bachelor's of science in business administration and management and marketing.
Good morning. Thank you for joining us for the I Want to Help Now, What Do I Do? My name is Dedra Chavis. I'm a licensed therapist. I bring you greetings from North Range Behavioral Health, where I serve as an infant and early childhood mental health consultant. My background in behavioral health starts with my trauma narrative. It comes from my own personal experiences and kind of my reactions and my responses to some of those experiences. I started out as a special education teacher because I was really wanting to work with families who I had mental health themes and also who had children who had developmental disabilities. I realized that that wasn't necessarily the space for me, so I transitioned to being a school counselor, and from a school counselor into more clinical work. I've worked in residential settings, I've worked in psychiatric, both inpatient and outpatient, and in my current position, I work with families who have children ages 0 to 6, and I support any needs that they have around social emotional learning. And I also hold a clinical caseload where I primarily work with 4-, 5-, and 6-year-olds who are struggling at home, at school, or in the community.
Okay. And I'm going to try and share my screen here.
Jennifer, I've got your slides up for you.
Thank you. So one of the things, if we'll go to the next slide, one of the things that is very helpful, I think, is to understand that behavioral health touches practically every field that you could work in. And so one of the things that I wanted to point out were some specific degrees, which would be like psychology, social work, criminal justice, business administration management, nursing, and special education teaching, because as Dedra said, it is one of those things that a lot of people don't realize how much our teachers play a part in being the first ones to identify individuals that need to get some behavioral health help. And those are the degrees that you can primarily work in. If we'll go to the next slide, there are some actual certificate programs and there was one that was brought out earlier today in this seminar from our panelists that I had forgot about. And that was our CAC certification, Certified Addiction Counseling. So there are ways that you can go about helping with getting a certificate program within academia. So you can become a certified nursing assistant, an emergency medical technician, or an EMT, paramedics, psychiatric technicians. Those are all things that a lot of times people don't realize, that with a bachelor's degree or coming into college or the university setting after being in high school, is what gamut of areas that they can actually go into and still work in behavioral health. Can we go to the next slide, please? One of the things that I wanted to point out, and if you were on earlier and talked with Megan, you heard Megan talking about the different avenues with nursing. So you don't have to actually start out in behavioral health as a nurse in order to help individuals with behavioral health needs. They're in every area of the health system, emergency rooms, inpatient, outpatient settings, that they can help you, and you can actually get into being able to provide services to individuals. One of the things that our nursing teams have done when I worked in the behavioral health setting, I worked both inpatient and outpatient, is that a lot of times our clients actually were forming connections with those nurses, because that's who they talked to, and that's who made them feel safe to continue to seek the services that they needed and schedule their appointments with their psychiatrists or their therapists. Same thing for our CNAs. CNAs can answer certain phone calls and help with that prospect. Psychiatric technicians, those are people that normally are on our inpatient units or in a living facility where you're doing at least temporary work with a patient. And those individuals have lots of skills, and you don't have to necessarily have a degree. Psychology is a lot of times what our psychiatric technicians have, but then they also go on to get a psychiatric certification for psychiatric technicians. Clinical managers run offices, help make sure that we have programs out there that are available, and marketing those to the individuals in areas that people need. So depending on the level in which you want to get involved in behavioral health, you can be a more hands-on approach, or you can be a little bit more off, like in the clinical managers roles that we would have, and non-clinical managers roles, schedulers. Again, I talked about teachers. We have one thing that a lot of people don't think about are how attorneys help in the behavioral health area. And I've had the opportunity to work with several attorneys that they specialized in behavioral health as the patients, that they're there to provide their voice when they're not able to do that for themselves. And so that attorney is looking out for the well-being of that individual during certain processes when an individual is unable to do that. A lot of our first responders, you think about an EMT, a paramedic, law enforcement, firefighters, they're dealing with individuals on a daily basis and in behavioral health. So it's really important to, as you approach this, to think again on what level of involvement that you want to have and how you can do that. And these are all areas to think about that you can do, and not have to, you can be either really right up there with your patients or clients side by side, or on a as needed basis, like some of these other roles. And that's what I wanted to bring today to let you hear about. Dedra? Deirdre, you're still on mute.
There we go, technology. Thank you so much, Jennifer. There are some questions in the chat box. If you could hold those questions, we will have some time at the end to answer those for you. I'm waiting on my PowerPoint to, there we go. Okay, can we just go to the next slide? Thank you so much. It really excites me to start this presentation with some data. Data really drives decisions and really helps with the implementation of a lot of those programs that you've already heard about. So given what we see on this screen, one of the things that we know for sure is that there is going to be a huge focus on hiring highly qualified candidates for these different behavioral health positions. So that's something to look forward to. I'm guessing that for those of you that are here, you're thinking about a career somewhere in behavioral health, and we're going to talk a little bit more deeply about those pathways, but hang on to that projection. I think it's really important to understand the labor market as you're considering a career in behavioral health. Next slide. So now, we've already heard about various roles in behavioral health. The idea behind this slide is to help you to start to understand what are employers going to be looking for. And the best answer that I can come up with is if you think about some of those buzzwords that maybe you've seen or you've added to your resume or that you've read on someone else's resume, what drives your professional identity? And I want to just bring your attention to the bottom left corner, the Venn diagram. As you're thinking about how you can choose, the first thing that's hugely important is to know yourself. Understand what careers are deal breakers. I thought for a very long time that I was going to work in psychiatric services. I did it, I loved it, but I realized that that was kind of just a season for me. I learned a whole lot of things and it was really time to move on. I don't know if you've ever heard of career assessments such as maybe Myers-Briggs or a strong interest inventory, but there are assessments that you can take there for free online to give you an idea of kind of what job outlooks parallels your personality. And that's not always the most important thing. The most important thing as I think about the big umbrella of behavioral health is identifying a work environment that fits your personality. Are you an introvert? Are you an extrovert? Are you a highly strategic person? Are you a person that likes to kind of process by yourself? Do you reflect outside? Just thinking about who you are and where your skills fit. And so I like to pose a question for you, and that question is, ask not what you can do with your degree or your certification or your skills, but what do you want to do with your major? Next slide. And so on this screen, what I wanted to do is kind of think through more of those roles that are underneath the clinical umbrella. And if I'm understanding correctly, many of you are either college students or high school students. So I wanted to make sure to add those to the list because there are many roles of behavioral health that's right there in your school. And so we've heard about school counseling, we've heard about inpatient, where clients typically live at a specific location, outpatient, where they show up for their treatment for their session, then they go back home and they're rescheduled to do those things. But then there's also roles where you support couples, or you support the family, or you're supporting an individual person as a part of a larger family system. My role is in early childhood, and so my population is very case specific. And so I love working with children. Now, middle school may not be a population that I would love to work with, but when you think about growth in that flexibility in who you are, you may want to find opportunities where you can kind of cross those different populations so that you can learn where you fit. Next slide, please. Earlier, one of the things that was mentioned is that not every role in behavioral health requires a degree. And I think it's really important for us to point that out, that there's a lot of roles where there is a certification. When we think about addictions, CAC and LACs, sometimes those certifications, what was the credential that they needed to obtain that job. But in the top middle box, in academia, these are often some of the courses that you will see as part of a program. Now, again, not every role in behavioral health requires a degree. There may be roles where you're hired in an organization, will do some on-the-job training and provide some platforms where you can learn. An example of that is Relias at North Range. There are opportunities for deeper learning. Some of those are assigned, and some of those are just based on things that you may be curious about. And so there's many platforms where you can enhance your learning. In terms of learning theory, at the very top, I put that there just so you can kind of understand that within psychology or within behavioral health, as you're thinking about pathways, you may be gravitate towards a very specific role or a specific population. And this kind of just helps break down what some of those roles or what some of those programs could be at your behavioral health organizations or local mental health entities. And those you can just Google and see who you're nearby. I heard Summit Stone in the panel, and then I work for North Range Behavioral Health. So as you think about where you would want to begin a career, consider this kind of these pillars that could help drive kind of your planning around that. Next slide. So now let's talk about the pathways. So there's kind of 3 pathways: entry level, mid-level, and advanced. Entry level typically would be someone who has maybe a high school diploma or GED that's getting started in the field. You're going to get on-the-job training. There's going to be very specific training that your organization will provide for you. Sorry about that. I had my timer set. And then mid-level, there's positions where if you have an associate's degree or a bachelor's degree, some of those roles could be a qualified mental health professional, a crisis worker, a case coordinator. You can also get some on-the-job training, and then some of those may also require some certifications so you can be compliant. And then the final is advanced. That's typically individuals who have either a master's or a PhD. I have a master's in agency counseling. I always knew that I wanted to work in community behavioral health. That's just a passion of mine. And so I finished that program. But in the state of Colorado, in order for me to serve as a therapist, I also have to have a LPC, which is a licensed professional counselor, so I can work as a clinician. Some of the roles at the advanced level, you can work in addictions, you can work in corrections, you can be a behavior analysis, a social worker, a psychologist. Of course, some of those roles require additional training as well. Next slide, please. The panel addressed some potential next steps. I totally agree that networking is one of the best ways to do it. I am slightly embarrassed to share this, but I used to badge stalk. And so when I would see people in the grocery store and they were wearing a badge and it said, I could see anything, behavioral health, mental health, health department, I would ask them, what did they do? And if I could come and visit, if I could shadow, if they had an internship program. Not every personality is okay with just walking up to people, and that's okay. You can call someone over the phone, you can send an email. For most behavioral health entities, they have their email and telephone numbers there. They will be more than glad to connect you to someone to answer some of your questions. But I wanted to just go back for just a second. Not every role in behavioral health has to be, as we've already heard, has to be direct service. There's careers in business. So if you enjoy marketing, brand management, social media is a big thing, maybe been a sales representative. There's also careers in research. Maybe you want to be a study coordinator, you want to be a project assistant. And so there's lots of roles under the behavioral health umbrella. I would suggest that to do just a little bit of research. You have a list of people now from today's session that you can reach out to and ask questions, and maybe we can even connect you to someone else. Next slide. All right, we are at the Q&A. I saw that there was some questions coming through the chat. Let's see here, just to go back. Let's see, there's a question. Looks like it's from Madeline. And Madeline is asking about occupational therapy and the graduate program. That one I am not familiar with, Madeline. What I might be able to recommend is there are some places online where you may be able to, I'm trying to think of one, ONET. And ONET, the way it's designed is you can usually type in a specific role or discipline, and then it will walk you through finding programs, kind of your employability skills, and some of the other things that you've already heard about in terms of identifying a program. So maybe you can try there. If not, maybe just Googling the closest maybe office to you and just calling and asking if someone could talk to you about what that process might look like. Let's see, here's a question. I want to make sure that I don't miss anyone.
I think Dedra, this is Jennifer. One of the, there's a couple of questions in there regarding where would someone get, or what does it look like to become a psychiatric technician? And I know, Jennifer, you had spoke to that.
Yes. There's an actual certification program where you take classes, and they're online classes in order to get that certification. I do not, off the top of my head, have the website, but I can get that, so we can have that posted somewhere for later if people would like to have resources to be able to do that. I can get that to you.
Yes, and another resource other than ONET is OOH, and you can just Google that. And again, that will help you connect to programs that offer that very specific discipline. And then you should be able to reach out to someone via email or telephone if you have further questions about what that may look like.
I think we have time for a couple more questions before we transition to the next session. Let's see. So we have another question about what is the best way to start programs that don't already exist? And we might need a little bit more clarification on that question, I think, to be able to answer that. So if you could type some further explanation into the chat box, that would be great. And then another question came up. Do you have to have a master's degree to counsel in public schools?
So I can answer the second question because I served in the role as a school counselor, and the answer is yes. And so you do have to have a master's degree, and you have to have a certification depending on that school district and that state in order to serve in that capacity. There are other roles in schools that are more paraprofessional positions that offers some really good training into that field if that's the interest. But it really just depends on the school district and what their needs are and their initiatives are around mental health.
Okay, so we do have a lot of questions coming up about CAC certifications, clinical licenses. the difference between those. So I'm recommending 2 people to attend the next session. There will be a lot of information provided in the next session about those addiction certifications as well as clinical licensure and what that might mean for you. Let's see. Do you have any opportunities or know of any opportunities to possibly get some exposure into this field, even if it is volunteer?
Jennifer, do you want to answer that one?
Sure. A lot of times, it depends on what level we're talking about as far as if we're talking about somebody in the high school level or somebody that's in a undergraduate degree, probably, as far as what opportunities are available for volunteering. So at a high school level, a lot of times the best way to do that is to reach out to your local behavioral health setting. So more like your community mental health centers, and talk to them and see what they have available. As far as at a university level, you can talk to your advisors, because your advisors in your degree program are normally tied to an organization that have memorandums of understanding that allow individuals into that area. And it's not as difficult as if you're just going out on your own to try and get somebody to allow you in to do some volunteering. So those would be the 2 avenues I would recommend at that level.
Yeah, I echo that, Jennifer. I see that there's a question in the chat asking about not being overwhelmed by so many variety. What I would recommend is think about a population that you would want to get started with. And behavioral health is on a spectrum. So there's certainly a difference between kind of our mental health and then mental illness. And so something maybe as simple as if you love children, find a childcare, ask if you can come and observe, just look at how those kids behave, how they jump, how they scream, how they play, how they cry. Maybe you like working with more the elderly or geriatric. Are there volunteer opportunities for you to go read stories or just to sit with those populations? Just take a notice to how they communicate, what they like, what has happened or what was said when they have a smile on their face. And so I think that in terms of getting kind of experience, just choose something that feels really simple, something that you may have in your life already that doesn't require a lot of planning and a lot of reaching out. If you play a sport, look at how the responses of your teammates, look at the personality of your teammates. If you're not an athlete and you're a person that loves technology, think about what you notice about yourself when you're embraced in those activities around computers. I know for me, I am not the most savvy at computers and I get so frustrated. And so there's lots of things that you can think about. If you're in high school, go to your school counselor. If you're a college student, use your career center, use career services. Ask for specific things. One of the questions was programs that's not already started. Sometimes there's grants out there and you can drive those programs. I wrote one when I was right after undergrad because I wanted to run a group with adolescents who also had a developmental disability and who were in foster care and. So consider the intersectionalities of the populations that you're working with. The sky's the limit.